Jack, come on. It's time to do some warm-up drills.
I don't want to be here. I'm always so tired and I have no energy. All I want to do is go home and go to sleep. I don't know what's going on with me.
Lately, I can't seem to concentrate on anything. It's becoming harder each day to do my coursework, and it feels like I'm missing so many things. I'm really worried that my grades are going to suffer.
I feel fine most of the time, but then all of a sudden, I start to feel really irritable, and I get annoyed with my friends really easily. My friend told me I should talk to someone about what's going on, but I don't know who I should talk to. I'm so confused.
There are lots of reasons why people think, feel, and act a certain way. It's not uncommon to be stressed, feel tired, or experience a range of emotions like anger, worry, or sadness, and even hear or see things that other people don't. But sometimes when these thoughts, feelings, and experiences don't seem to get better, you may need to seek out support. I know this because my problems didn't go away, so I asked my professor for help. Hi, Professor Daly. I've been having trouble concentrating lately. I'm not sure what's going on.
Well, I'm glad you came to talk with me, Tammy, because you should always tell someone you trust when you aren't feeling well. Have a seat and let's talk.
After I talked to Professor Daly, she was able to connect me with a university counselor who offered me support and steps I could take to help me approach my parents, and together, we were able to start getting me the help I needed. Remember, you are the most important advocate when it comes to your health, and your voice matters. So speak up if something doesn't feel right. Talk to your teachers, parents, friends, and other adults you trust in your life and ask for help. We all need help from time to time.
That's why I talked to my coach about how I was feeling. In fact, the sooner you can start to identify some of the challenges you're experiencing, the better. Because there are so many effective support options and resources to help people reduce their symptoms and get them back on track.
I started to see a therapist, and I could tell her all of the things I was experiencing. I didn't feel alone anymore, and we worked together to come up with a plan to help me.
Here are some things to look out for. And remember, if you experience any of these, talk to someone, because that's the first step to getting help. Difficulty staying on top of taking care of yourself, like with showering and cleaning up. Feeling just not like yourself and losing interest in things you once enjoyed. Hearing or seeing things that other people can't. For example, we all have an inside voice and talk to ourselves during the day, but the difference between that, which happens to everyone, and a sign of a mental health concern is when the voice isn't under our control, and it may seem like it's coming from somewhere else. The people around you may notice that what you're saying doesn't quite make sense, or your body language is different. You may feel really intense emotions, or you may not know how to express how you're feeling. You may also feel like people around you are out to get you, or that they can't be trusted, or start to believe that you are at the center of some kind of conspiracy. Even when your friends and family assure you it's not true, you just can't shake the feeling. Your energy level may be really high or really low, like you feel like you have too much energy or not enough.
Now that you know what to look out for and who to speak to, that's the first step in starting to feel better. There are so many great options for support out there.
Like talking to a therapist, care coordinator, or peers.
Or taking medication.
I like to exercise and eat healthy.
Recovery is different for everybody, and your team will help you connect with the best options for you.
By recognizing these early thoughts, feelings, and behaviors and speaking up, you can start to get the support and care you need.